Hi, this is Carol Anderson. Today we're going to be talking about antivirals, antiretrovirals, and antifungal medications, along with antiparasitic drugs. There have been over 200 viruses identified. However, the antiviral medicines that are available are very limited in their effectiveness. The viruses which antiviral medication can effectively treat include cutaneous herpes simplex, herpes zoster, HIV, CMV retinitis, genital herpes, influenza A, and hepatitis. Viruses can only replicate if they invade and take over a cell. Antivirals act by inhibiting viral DNA or RNA replication within the virus, ultimately causing viral death. Antivirals include acyclovir, amantadine, ribavirin, valacyclovir, and zanamivir. Antivirals can be administered systemically or topically. Adverse effects to antivirals given systemically include GI disturbances such as nausea, vomiting, diarrhea, and anorexia. Topical medications can sometimes cause transient burning, stinging, and itching at the site of application. Rapid IV administration can cause formation of crystals in the urine. Patient education for someone receiving antiviral should include instructions to take the drug as prescribed. If a dose is missed, they should take it as soon as they remember, but not to double dose. Understand that the drug does not cure, but will decrease symptoms and increase feelings of well-being. And that they're also to report any signs or symptoms of infection, such as temperature, sore throat, difficulty breathing, abdominal pain, jaundice, peripheral neuritis. Antiretroviral drugs are used to treat HIV, which stands for human immunodeficiency virus, which often will develop into AIDS. HIV destroys the immune system and allows the body to develop life-threatening opportunistic infections and cancers. All of the antiretrovirals are used to decrease morbidity and mortality associated with HIV by preventing viral replication, also referred to as viral load. There are different categories of antiretroviral drugs, and each is based on the site of intervention in the inhibition of HIV replication within the cell. Note on this slide that the points in red are the points at which the antiretrovirals inhibit replication of the virus. Please watch the next slide regarding antiretroviral medications. Each category of antiretroviral medication has specific adverse effects. Some of these adverse effects include things like GI symptoms, liver toxicity, bacterial pneumonia, muscle weakness, Stevens-Johnson syndrome, hyperglycemia, hyperlipidemia, to include just a few. In educating your patients who may be taking antiretroviral medicines, it's important to remind them that these medications are not a cure, that they do not reduce the risk of transmission of HIV, and that they should take each medicine as prescribed, including whether it's to be taken with food or not, and they should not skip doses, alter doses, or discontinue any of the medicine without direction from their healthcare provider. Fungal infections. These are also called mycotic infections. They may be superficial infections such as athlete's foot, jock itch, ringworm, nail fungus, and yeast infections, which would include thrush or vaginal yeast infection. Antifungal drugs may be fungicidal, which means they destroy the fungus, or they may be fungostatic, which means they slow or stop the multiplication of the fungi. Some of the more common antifungals are amphotericin, fluconazole, ketoconazole, and miconazole. On the next slide is a video about antifungal medications. Patient education. Some things to remember in educating your patients who have been given antifungal medication. Always instruct them to not increase or decrease the amount of ointment or cream that they're using unless instructed by their healthcare provider. Also remember, if they're being treated for a fungus infection that is considered to be contagious, such as ringworm, always instruct them to use separate towels, washcloths, and wear gloves. Parasites. Parasites are organisms that live in or on another organism without contributing to that organism's well-being. There are worldwide health problems that are caused by parasites, such as helminths, which are worms, amoebas, and protozoa, which can be the cause of malaria. Following on the next 3 slides are short videos which describe each of these 3 types of parasites. Antiparasites are used to destroy the parasite at some point in their life cycle. Some common drugs that are used to treat malaria are chloroquine and quinine. Some that are used to treat helminths or worms are called Vermox or Albenza. And then those that are used to treat amoeba infections are Flagyl and Yodoxin. Over half of worldwide deaths due to infectious organisms are due to malaria, TB, and HIV. Perhaps the best way to reduce the prevalence and mortality related to these viruses, fungi, and parasites is through prevention. Prevention can include vaccinations, safe sex practices, and hygiene, such as hand washing and clean food prep. On your next online assignment, you'll be introduced to a new strategy in the prevention of new viruses. Thanks for listening to the PowerPoint. This is Carol, and I'll see you in class.